So today we are going to discuss a very important topics, that is Neuroleptic Malignant Syndrome. Neuroleptic Malignant Syndrome is a rare but potentially serious or even fatal adverse effects of antipsychotic and other dopamine antagonists. It is an acute disorder of thermoregulation and neuromotor control and characterized by muscular rigidity, hypothermia, altered level of consciousness, and autonomic dysfunction. Now we can see there is some very important box. What are the signs and symptoms? That includes fever, diaphoresis, muscle rigidity, confusion, fluctuating level of consciousness, labile or very high blood pressure, tachycardia. And regarding laboratory investigation, we can find that is creatinine kinase is elevated, that is more than 1000 units per liter. And in full blood count, we can find leukocytosis and altered level of liver function test. There are some risk factors that includes high potency of first generation antipsychotics, recent or rapid dose increases, also rapid dose reduction, abrupt withdrawal of anticholinergic agents, and antipsychotic polypharmacy. There are also some risk factors like psychosis, organic brain disease, alcoholism, Parkinson's disease, hyperthyroidism, psychomotor agitation, and cognitive impairment. Male gender, younger age, agitation, and dehydration are all the risk factors. So treatment we can divide into two categories, in psychiatric unit and medical or emergency unit. In psychiatric unit, we have to first withdraw the antipsychotic medication that is responsible for NMS, monitor the vital signs like pulse, blood pressure, temperature, respiratory rate, and consider benzodiazepine if not already prescribed, and in that case, intramuscular lorazepam is a good choice. In case of medical or emergency unit, first we have to rehydrate the patient. We can give bromocriptine and dantrolene, sedation with benzodiazepine, and artificial ventilation may be required if needed. So regarding restarting the antipsychotics, first we need to stop the antipsychotic medication which is responsible for NMS for at least 5 days or preferably longer. Allow time for symptoms and signs for the NMS to resolve completely. And begin with a very small dose and increase very slowly with close monitoring of temperature, pulse, blood pressure, and other vital parameters. Creatinine kinase monitoring may be used, but in some cases studies it is found that it is controversial. And consider using the antipsychotic, we need to choose those antipsychotic that is structurally unrelated to that or previously associated with NMS or drug that is low affinity with, like butapine or clozapine. Aripiprazole may also be considered, but though it has a long plasma half-life and it may be associated with increased NMS, so we should keep that in mind. And there are some other risk factors like male dehydration, exhaustion, and confusion agitation, as we have discussed earlier. Young adult male may seem to be particularly at risk, but while the condition is more likely to be lethal in older people. And MN is a rare condition that occurs only 0.02 to 0.03% of cases, but mortality rate is high, it's 5.6%. And not only NMS is also associated with antipsychotic medication, there are some other medications like antidepressant, valproate, phenytoin, lithium may also cause NMS. And the co-prescription of SSRI with cholinesterase inhibitor with antipsychotic medication may increase the risk of NMS. NMS is also occasionally seen in people given with non-psychotropic dopamine antagonists such as metoclopramide and prochlorperazine. So that's all for NMS and Neuroleptic Malignant Syndrome, and stay tuned for another high-end topics. Thank you all.